Good morning, dear. I am Dr. Anil Garg, plastic surgeon, MS MCH. I am diplomate of American Board of Hair Restoration Surgery and member of International Society of Hair Restoration Surgery and Indian Society of Hair Restoration Surgery. I do hair transplant and do other cosmetic and plastic surgery. The problem of hair loss and baldness is increasing day by day. You are lost hair, you are looking bald, and still you are losing hair. It worries you. It directly pinches your heart and make you feel low. And you are searching for an answer. Yes, you need answer. And there are effective answers to control the hair loss and to cover your bald area by hair transplant. But you have to find out a proper person, a proper place where you can go. When you start searching, you go first on the website, then you see the print media, digital media, and many things are there. And you get confused. Everyone claims very high. Everyone claims that he is the best, he is the most experienced person. So how to decide about? Here I am going to tell you scientifically and meticulously how you can decide and choose a good hair transplant surgeon for you. There are three things important for it. One is the surgeon. Another thing is the center where he is going to perform your surgery. And third is his team. Now the surgeon. Important thing is his qualification. What qualification he has got, you can look in his advertisement, you can look on his website and other media. What qualification? He is a postgraduate or a medical graduate or super specialist like I am a plastic surgeon, I am MCH plastic surgeon. I am entitled to do the plastic hair transplant surgery and other cosmetic surgery. Then you have to see whether that particular degree is recognized by the Medical Council of India or not. Means his qualifications should be recognized by the local health and the government authorities. Then and then you can say that he is a qualified surgeon or a person who is doing transplant. Then another thing is, does he have enough experience for that? Hair transplant is still a subspecialty. There is no direct degree of hair transplant like plastic surgery, MCS, like MD dermatology, MS general surgery or MS ENT. There is no direct degree of hair transplant. It is a subspecialty. It is being taught under the other specialties like dermatology, plastic surgery and so on other branches. Dentists are till date not allowed. Non-allopathic doctors like homeopath, Ayurveda, they are not allowed to do. So you have to see that particular doctor is an allopathic doctor or not. He is allowed to do hair restoration or not. And his qualifications are recognized or not. Another thing is, does he have experience? Many of the plastic surgeon, dermatologist, surgeon or ENT surgeon or other may not. They are qualified. Their degrees are recognized, but they are not trained. They have not done hair transplant. So the experience in hair restoration is another important aspect which you must look for. Then many times you see long degrees in front of their name in website. They mention various membership of various association. So like ISHRS, like AHRS, you must see. EPSICON, ESICON, there are many associations are there, and to confirm that you can go on their website, means the website of the association, and find out whether they are really member of that society or not. Like I am member of ISHRS, I write ISHRS member, then you can open the ISHRS website and you can find out my name. I am also ABHRS, Diplomate of American Board. You can look the website of ABHRS and confirm that really I am ABHRS or not. Similarly, AHRS India, Association of Hair Restoration Surgeons of India, I am the member of that. You can confirm and going on the website. That's how you have to confirm everything what you see or what is given on the net. Merely just don't believe what they have written. They might have written right thing, but there are few persons who put fake information. So it is your duty to confirm that, because it is your head, it is your dream to get hair that may be spoiled. So it will be your mistake. Now next comes is the center. The center where he is going to treat you, where he is going to perform your surgery. So there are few important things which you must check out. First of all, you should visit the center and see it is clean or not. Just by one glimpse you can find out this center is proper or not. Then operation theatre. Does that operation theatre has got all emergency equipments or not? Although hair transplant surgery is a safe surgery, usually there is no complication, but it is still a surgery, whether it's a minor or major, and you have got only one life. So you must check that do they have the defibrillator, they have the oxygen cylinder, boil separators, emergency intubation, emergency drugs and all that. These all things you must see. Then the sterilization technique. You can frankly ask them, how do you sterilize your instruments? What is your sterilization protocol? That you must see, because sometimes the infection can lead to disaster in hair transplant, although it is very, very rare, but you must see that point of view. Then their center is recognized by local health authorities like Chief Medical Officer, CMHO or not. There are 2-3 licenses in India. Local health authority like CMHO or Chief Medical Officer of the city had got registration process, so they should register with themselves. Then there are many other registration, pollution control is there, then few more registration, Nagar Nigam, municipal corporation registrations are there. Are they having that or not? That will further clarify you if that center and that doctor is really ethical, doing ethical practice or not. Then third thing comes is his team, technicians. Technician in hair transplant is a surgery which is not totally from zero to end is done by surgeon. Usual protocol is surgeon extract the grafts either by FUE or they harvest the strip if they are doing by the FUT method. This should be done by the surgeon. Then the slit making in which the grafts are to be put is done by the surgeon. But the implantation usually is done by the assistant or trained technicians. You must ask frankly, what is the qualification of your technicians? Are they registered? Another thing is, are they trained enough? For how long they have been doing? Another very important thing which is very common nowadays is a team of assistant is there. They visit various centers and they do the entire hair transplant, and sometimes surgeon is sitting in their chamber, and unfortunately many times the surgeon is not there at all in the center and the entire process is performed by this only the technician team, and they are roaming around from one place to another place. That is not good. You must ask, are your technicians are full-timer or for how long they are working with you? This is an important aspect. And what is the work done by the surgeon? What is the work delegated to the assistant? You have all the right to ask and inquire about that. So that is the tech team is also very important. So I sum up, surgeon, most important, his qualification should be recognized by the government and Medical Council of India. Then comes the center, it should have the registration from the local health authorities, should be equipped to deal with all the emergency. It should have the oxygen, boil separators, emergency equipments and all that. There should be good hygiene in that, good facilities, power backup, generator and all things are AC, air conditioning, these all things are important for hair restoration. And how they are doing the sterilization. And then lastly, which is not least very important, is the team of technicians. are they trained or not, and what work is done by the technician and what is done by the assistant. You have all the right to know. So you make a checklist, go one by one. Last thing is the price, cost of the hair transplant. I will tell you one word, don't decide your surgeon just on the basis of the finance. A cheap surgeon may be good, may not be good. A expensive surgeon whose charges are very fine, very high, it's not necessary that he is good, and so as he is not necessary that all high charge surgeons are bad or good. The criteria which I told you, you must confirm, then you ask them frankly how they are charging. Are they charging per hair? Are they charging per graft? Are they charging per square centimeter? Follow-up, visits and everything you must ask about your charges. Government tax, GST, service tax and other taxes has been included. Medicine charges has been included or not. See, there is no shame, there is no hesitation. Clear cut everything you ask, because you are going to pay. So my dear friends, just go through, listen all these what I told you, note down and then decide about your hair transplant surgeon. I am sure there are enough good doctors, there are enough good surgeons who are doing only and only ethical practice. They are there. Only thing is that you have to find them out. Thank you very much. If you want to know anything more from me, you can call us on 9144444433. Thank you.